Over 25 million Americans struggle every day with varicose veins. Over half of Americans over the age of 50. Dr. Michael Kohlman of Cass Regional Medical Center joins us this morning with more on a treatment called intravenous radiofrequency ablation. Welcome to the show.
Thank you.
As we just said, it's a very common problem for men and women.
Over 55% of females over 50 and 45% of males over 50 are affected with this problem. It's also commonly seen in people who stand on their legs for long periods of time, or even people who sit for long periods of time can be affected with it.
So this can affect people that are younger as well.
Oh yeah, any age it can really affect it.
Okay, so let's talk about the symptoms. Obviously you can see kind of the bluish vein coming through the skin, and it can get to the point where there's a lot of discomfort and pain.
Absolutely. Some of the common symptoms that people will complain about is swollen or achy legs at the end of the day. Their feet will be swollen. They can have itching or aching around the ankles. They can develop some skin discoloration around the ankles and the tops of the feet. And then some people with really bad varicose veins can develop ulcers on their legs.
Which I imagine is dangerous.
Yeah, they can get infected and cause a big problem.
Okay, so what is this treatment that you're talking about?
Well, traditionally, they used to do things called vein stripping, which involved a large incision up by the groin. They'd go into the vein and then basically strip the vein out. And
sounds painful.
It's very painful.
Yeah.
It can cause a lot of bruising, and then the potential for complication afterwards is pretty high. This particular procedure, we'd access the vein down near the ankle or in the calf area, and then we pass a catheter up the length of the vein, and that essentially heats the vein from the inside, causing the vein to collapse. So very much less bruising and much less discomfort after the procedure.
So how long does the procedure take, and then is it a few days, is it a month before you see like the results and feel okay?
The procedure itself takes anywhere from an hour to a couple hours. We can do one or both legs at the same time. During the procedure you have very little, if any, discomfort at all. Afterwards you'll get some leg wraps for the first 24 hours. Then after 24 hours you'll wear some compression garments for the next 2 weeks, which reduces the swelling and the bruising in the legs. It'll also help keep the vein closed. At about 2 weeks, you'll notice some results. At about 3 months, you'll notice a significant difference in the varicosities in your veins. Most significantly, patients usually report decreased pain and swelling almost immediately.
I was going to ask you, what is the reaction from your patients, other than thank you?
Yeah, it's been really good. Patients usually state that the pain and the swelling that they've had in their legs, difficulty putting on their shoes at the end of the day, all goes away, and they just feel so much better.
And especially for if someone's younger, and I imagine that it's a cosmetic concern too.
Especially in young women who wear shorts and skirts, they can be very conscious of the veins in the legs. So
you don't want people to be like, well, what's wrong with your leg? What happened there?
Exactly.
And so this treatment can solve that problem with very little discomfort, very little downtime, a relatively quick procedure?
Really quick procedure, and really the day after the procedure we're asking you to just go about your normal day.
Who do you go to when you have this problem? Who's the first person you stop at before you get to?
First person you want to talk to is your family practice doctor. They kind of look over the symptoms, see if it would be appropriate or that you have some of the symptoms. Most of the time you can discover these varicose veins right at a general examination. And then afterwards, they can be referred to the surgeon. He can further evaluate you and maybe get an ultrasound to look at your legs more in detail.
All right. Well, to learn more, you can visit cassregional.org. It's important information, especially as we get into swimsuit, short season, skirt season. We're all thinking about that right now. When it's winter, it's like our legs are covered. It's fine. But now it's like in the front of our mind. So thank you so much for joining us. We appreciate it. Let's toss